As we remember the horrific events of the 9/11 terror attacks 19 years ago, many emotions can surface, and for some, it might even trigger post-traumatic stress. I'm joined by Pat Rehmer. She is the president of the Behavioral Health Network at Hartford Healthcare. Welcome.
Thank you.
So what kind of emotions can be expected, even just seeing all the posts on social media?
Well, I do think that this could, trigger some PTSD for some individuals, but I think those people will probably people who have lost someone, even though it's been 19 years, it's still a loss. Um, and the first responders, right? Those are the people that will probably have some trouble with this as well. The difference, frankly, between this and the current pandemic, however, the positive difference, I guess, if you can find one, is that the grief that people are experiencing now related to COVID, for example, has been interrupted and is somewhat disrupted. The grief for individuals around 9/11 hopefully was not as disrupted, and so people may have been able to resolve things a little bit more easily.
Right, and you're right. There may be people who are grieving even through the loss of someone through COVID, and perhaps they also were connected to 9/11. But even just memories, like the roots of things, just having this memory of 9/11, can that heighten the grief that you're feeling today?
Yes, I think absolutely. I mean, when everybody is, it's not like losing someone under normal circumstances where obviously you experience it and the rest of the world does not. So everybody is not looking at it. This is a very different experience. Everybody is looking at this again this morning. And so for people who do have PTSD, either from being a first responder or somebody who lost someone, all of these visual images and everything could definitely stir that up.
And you know, feeling sad's not bad. I know in your industry they often say we need to feel it to heal it. Can you give some perspective on that and when it might be time to reach out to get help?
Right. So I think that, yes, working through grief is important and you do need to experience it. It won't necessarily go away on its own. But I think people have to understand if they experience different difficulties sleeping, eating, experiencing enjoyment, sadness that lasts an unusually long time, several months, for example. I think that when that happens, or clearly if somebody is experiencing any thoughts of suicide, they need to reach out to mental health providers and professionals.
Absolutely. I know Hartford Healthcare has a hotline right on the website if you want to shout that out to folks, because I know you're available 24/7 to help people.
Right. We are absolutely available 24/7 to help people and to get people into treatment.
Yes, we'll have a link, of course, on WFSB.com and on our app to reach, so people can reach out for help if they need it. Pat Rehmer, thank you so much for being with us.
Thank you.